All right. Good morning, everyone, again. Thank you so much for coming. And there are those who come to see me speak. That's so encouraging to me. Now it just puts extra pressure, but no pressure, right? So, I own and CEO of Chaw Family Wellness, and that is the company that I started. But I want to show you my guinea pigs first before I started. These are my guinea pigs before I even know whether I should open a private practice or not. My parents are the number one guinea pigs, and I'll tell you about them a little bit later. But I get asked a lot of how did you come up with the name Chaw Family Wellness? It's like, well, let's me go to the next one. There are two reasons I named my company Chaw Family Wellness. Number one, my husband's name is Charles, and so my parents, they speak like 4 languages. And so when they come to the R in the English word, they could not pronounce it. So every day they will go, Cha, do you want something to eat? Cha, how are you today? Cha, are you thirsty? So there's the Cha in my family. And then on top of that, it just so happens that the initials of my family members are C-H-A. C is my name. My full name is Chiblang. Yin Chiblang is what's the name I was born with. My husband's name is Henry. My little girl, 11 years old, is Ava. So we got C-H-A. It's like, I help people from 3 to 120 years old. So I go, I'll just name my company Chaw Family Wellness. And so these, I gave you a picture of my family with my guinea pig, but the 2 most important people in my life are my parents, my elderly parents. I took care of them, watch over them, and visit them every single day. And so for 5 to 10 years, it'll be a cycle of doctor's appointments, pills, surgery, doctor's appointments, pills, doctor's appointment. It's like, okay, I see a circle. What is wrong with this picture? Why isn't there a stopping point? And so as a believer, I prayed about it. It's like, okay, I need something different with this cycle. I need an answer. I need to find someone who can help my parents to break this cycle. Or without even knowing, I don't know how I did that, I put in the prayers like, well, then teach me so I can take care of my parents even better, God. And then, without knowing, in the next networking group, I met the director of the school. And then, of course, all the negativity comes, can you go back to school? And because I already got my bachelor's, I already had a good job. I was a civilian contractor for the Air Force Academy for 10 years. So at that time, it's like, I have a good job. Why would I need to go back to school? So I said no the first time. So I met her again 3 years later. And she approached me, hey, you'll be a good candidate for my program. It's like, okay, fine. I'll go give this a try, see what happens. And then fast forward, poof, I practice on my parents. And my number one thing is that my mom will call me to make an appointment for either a chiropractor or an acupuncturist or this person or that person. So one day, let's see if I can get my. So one day, she called me up and said, oh, my neck hurts. And then my dad in the background said, well, you stop calling her to make an appointment with your own daughter. And I'm like, did I just heard that correctly? My own dad is my own marketing sales rep. And so from that on, it was like, maybe I could do this. Maybe I could open my own private practice. And so these are the list of what I do. And the list of what I do is the top 3 is what people know me as, but I also cover the other ones as well. And I'll go through them later on in the case study. So when I signed up to present, I was like, okay, what do people want to know? What do people care about in what I do? What do I want people to know about? It's like, oh, too many information. And so I bottle it down, or I summarize it down to, I'll just share success stories and see what people think about that. And so acupressure, therapy, cranial psychotherapy, somatic trauma release is the main ones, but we'll go through them. Hopefully, I'll touch on the most important ones for my stories. And so success story number 1, client M. Nobody knows it stands for mom. She has spinal decompression surgery. She has chronic low back pain. So that's the reason why she retired in the first place. And thus she couldn't continue on working. And so I use something called a Hara assessment. And what it is in the stomach area. Hara is a Japanese word for stomach, because all the meridians, so acupressure is all the Chinese meridians, just the same as acupuncture. And each point does certain things on the body. So when I go to the stomach area, it's all the intersections of the meridians, and they're master points. So when I touch one point, I can access multiple meridians at the same time, multiple organs at the same time, and multiple emotion imbalance at the same time. And so with her, I use craniosacral therapy, and I use pelvic rebalancing. And so session 1, I did a pelvic rebalancing on her, and then she goes, "But my head hurts. Why are you working my pelvis?" Because it's the foundation where everything flows through. And so when I do a follow-up session, of course I have to do some follow-up sessions with client M to see how she's doing. And then when I ask her, I say, "Do I need to make an appointment with another doctor for you?" She goes, "No, I'm good." And she went out to the kitchen. Like, okay, I think my services are mother and father approved. I think. Client A. Client A is 21 years old, low back pain. So one of my favorite stories is that she came in with low back pain. She goes, "Hey, I have a chiropractic appointment, but my chiropractor is very busy and have not been able to see me for 2 months. Can you see me?" I said, "Yes, I can. I have 12 acupressure points protocol for low back pain." So she came in. So acupressure number 1 worked as textbook. Then number 2, she started bawling on my table. It's like, okay, this is not physical. So of course in my mind I said, it's not physical. I need to switch over to trauma therapy. Of course I don't say that during the middle of the session while she's there laying there crying. So then I ask her, "If you're willing, tell me what you got triggered. If you're willing to share, I can help you unpack it." So she did. She thought that she was over it. She has been in therapy sessions since she was 6 years old. And I go, "There's just layers of trauma, so just let me know and how can I help?" So I did. I helped her, and then towards the end of the session, I asked her, "Check your body before I go to point number 3. Check your body." She goes, "The pain is gone." But the icing on the cake is when she came up for a follow-up appointment. She goes, she called me up on her way to the appointment. She goes, "I need to tell you this, I can't wait." "Okay, what is it? Tell me." She goes, "I've been having nightmares since I was 6 years old, going to a house. I am always, when I wake up, kicking and screaming and sweating, like in high alert, cannot go back to sleep for like 2 or 3 hours. However, after last session, I had that dream one more time. The house was empty." She goes, "I don't know what to do with that." Guess what I said? "I do. Come on in, I'll see you soon." So a note that I would like to share is that I mix and match my modalities, those 8+ modalities. I have a client who comes in and say, "I know I need help. I don't know which modality I need." I go, "That's okay. Your body will tell me." And so I mix and match modalities per session to whatever the client's needs. Next story, client K, female, 57 years old. She had a slip and fall. Her tailbone was crooked because she landed on her butt, and then she landed on her side, of course, and she goes, "I know I need help, but I don't want anybody to touch me." It's like, okay, challenge accepted. And so I use something called cuddle light therapy instead, because I don't have to touch her. But I did. I lightly touched only on the surface just to find out, just to make sure I hit the right landmark. And I used cuddle light therapy on her. And I used another modality called neurological entrainment, that just to calm down the nervous system. Because when you're on edge, everything is irritated in the body. Everything cannot be touched. You can't even be in the vicinity. She will scream at you. So I could use something that's in a distance. So when it's energy work, acupressure therapy is energy meridians. You don't have to touch them. I don't have to touch them to work on them. I can work off the body. I can use color light. And one thing she told me, she goes, "I can feel it." It was in halfway the session when I was working on her tailbone with the light. She goes, "I feel like you can touch me forever." I go, "I haven't touched you." She goes, "And I feel like my tailbone just moved." It's like, that is awesome. And so non-contact it is. client T, 54 years old, female, in a car accident. So she was in a car accident, but one thing she said to me is like, it wasn't a big car accident, but she does not understand why her life turned upside down. This client has a stress and anxiety, not just for driving, but for life as well. She can't get back into the car to drive again, and she believes that her marriage was falling apart. Everyone is against her. Everyone at work hates her. The world does not care about her. So this car accident is, so in an example like this, I explained to her that the car accident is just the last straw to break the camel's back, so to speak, that just tipped everything over. Because there has been bottled emotions all this time, from who knows when, that the car accident just explodes everything in your life and you think that you're not worth it. And so for this one, I use somatic trauma release therapy, and I use fear trauma therapy to, one, to get rid of the fear, and two, to find out where the trauma is. So for trauma therapy, I talk about suppressed emotions that manifest as pain. So one way to explain it is like, you have 5 years old. Mom and dad are fighting, and the poor little 5-year-old doesn't know how to process that information. So then that little 5-year-old might think, oh, is it about me? Are they fighting about me? Is it my fault? Why are they not paying attention to me? Why are they screaming? Then the poor little 5-year-old is confused and not knowing, and self-blame, but not knowing how to process that. That's open a folder, so to speak. Open a folder and just being compressed and suppressed. Fast forward to high school. You have peer pressure. You have grades. You have social anxiety. You have this, you have that. Now, if that person doesn't have a way to cope in a healthy way, that's suppressed again. So this folder of confusion, of fear, of it's maybe my fault, of maybe I'm not important, keeps growing and growing and growing. Fast forward to adulthood. Whether it's peer pressure at work, whether it's marriage issue, whether it's job issue, and if that person does not know how to process that information, then that folder or closet keeps growing up. And one incident can make that folder just explode into smithereens. And so car accidents one, divorce is another one, loss of a job, unemployment, anything, any life event can explode that bottled up emotion. And so for this person, when they came to me, everything is like 9 out of 10, 8 out of 10, 10 out of 10 in stress and anxiety scale. And so in data collection, I go back to where it started at the childhood and unpack that with her. And then I believe for her it was 5 months later, she's like, I can conquer the world. I don't need therapy anymore. So she went and conquered the world, and trauma therapy helped her. So for this one, I'd just like to add that I take car insurance. People ask me if I take health insurance. I don't. I do not take any health insurance because there's too many hurdles for me to, as a solopreneur. And but I do take car insurance in the form of medical liens. So if someone is in a car accident recently and their case is still open, I can use a medical lien, I can use their car insurance to see them with zero out of pocket. The next one, female, registered nurse, personal injury. Her head got hit by the trunk when she was closing it. She was actually, because the dog, I was like, why would you stand in front of your trunk being closed? But then when I heard the story, she goes, no, there was a dog running and she was trying to grab something right quick and she thought she was able to get out on time and misjudged the timing a little bit, hit her head. And of course she has neck injury, shoulder pain and all, and headache. And for her, cupping. So somatic trauma released what held it in place. Craniosacral therapy opened the pathways from the tailbone to the head so things can flow and heal and reduce inflammation. But for her, cupping, because her gallbladder was already weak, and so it had the opportunity to be weaker when she got hit in the head. So cupping in the gallbladder meridian released that to the point that she said, oh, didn't know that cupping can do such a thing. But yeah, but for her, cupping through the meridian channel helped release the pain. How much time do I have? Let's see, next story. Female, massage therapist, personal injury. She sprained, somehow she was carrying a heavy load and sprained her shoulder. And then, but on top of that, because she waited, I don't remember the full story, but she had this injury for 3 years. It just didn't go away. It just, no one could take it out. So when I asked her a certain question, she goes, you know what? I felt like there's an imaginary screw that's in my shoulder blade that's preventing me from moving my shoulder in the correct direction. And it's always a little pinch in the shoulder blade. And she said it's just there for the past few years, to the point that she thinks it's gonna be normal for her life. When I hear there's pain, that's not normal. And so because it lasted for 3 years, I used trauma therapy to work on it. And then of course there's acupressure points protocol for the shoulder. And so for the trauma therapy part, this is the part that got her to release the screw. Because in trauma therapy, I found out how that screw that was in there. So people talk about phantom pain. People talk about, you're gonna think I'm crazy because I think there's a screw here, or because I think I have a fin here. I'm like, okay, in this room, when I work in the energetic level, nothing is crazy. Tell me your story. And so when she told me her story, we found the location of the imaginary screw, which meridian it was pinpointing at. It was pointing at a meridian. And so using the acupressure point with trauma to see where it landed in the first place, released it in one session. So for her, she didn't have to come back for a follow-up. She goes, I don't need it. I felt it being pulled out, and I felt that it was gone, and I don't have the pain anymore. So my note for this one is, when people talk about phantom pain, in Eastern medicine, we think about meridians. In the Western world, it's like if they can't see it, they don't know how to operate. But you have to go to the energetic world to operate things that people are feeling, because they are not crazy. They just don't know half the words to say it. Let's see. This is one of my favorite clients. She was dragged in by her aunt. So her aunt came into me because she needs help, and she dragged in her niece because her niece was depressed, had no goals for life. When I talked to the niece, when I talked to see if she wants to do any exercises to help with stress and anxiety, when I asked her if she wants to do this, wants to do that, she's like, I don't know. Meh. It's like, okay, this is gonna be a challenging one. And so, but as we worked on with finding out her traumatic childhood, because she had a very traumatic childhood, she was abused, she was neglected, so no wonder she doesn't have any excitement in life. And so I was happy that her aunt dragged her in, because nowadays she called me up saying, I have a job, I have a goal in life, I got my driver's license, I want to be a mechanic sometime in the future. Right now it's a hobby. I'm a teacher right now. And I still want to have a session with you out of pocket myself, so my aunt doesn't have to pay for me anymore. It's like, you're one of my favorite stories. And so people, and what I want to educate is childhood trauma, when it runs 24/7 in the background, because from 0 to 8, we create pillars of belief system. And so that pillar belief system runs in the background 24/7, and it dictates the way you see the world. Whether you're subconscious about it or conscious about it, it will run the way you see the world. So in order to change that paradigm, you have to go back to the childhood memory where it created that belief system, change it so they can change the present day outlook. And so this one is an example of what trauma therapy can do to change that paradigm. Roof inspector. So my first client of all, he was 55 years old, a roof inspector, fell off the roof. You can imagine what that would do to the body. When he came into my office, he had to use the wall to walk in, and he was a little bit dizzy, and he cannot lay down on his right side because the right hip was bruised. And so I checked to see which meridian needs to be worked on. But of course, because he just fell from the roof, that is physical. Acupressure therapy and pelvic rebalancing was the main therapy used for him. So when I went to the pelvis area, because it's the foundation, everything goes through the pelvis. So if the pelvis is tilted, up is tilted, down is tilted. And so when I balanced the pelvis and checking on his meridians, and at the end, he was just got up and walked out my door and like, hold on, what's going on? He goes, I feel good now. I can walk again. It's like, oh, okay. Now for him, I didn't have to use any trauma therapy because it was an acute pain. It was a fall from the roof. It was not 5 years, 10 years, 20 years. So his one was a once in a lifetime story of only one appointment to help him walk again. One more, I have one more story to share. One more story to share is a male, 51 years old, martial arts with a black belt. I think he's like a 3rd degree black belt. I don't remember the number. But he came in to see if I can help him with his facial features, with the jaw, because his jaw was, he was getting braces and getting alignment and all that. He just want to make sure that it doesn't affect his skull and his brain because he wants to be a top-notch martial artist. And then in the conversation, he goes, oh yeah, my right hip clicks. It's just been that way, it's normal. My brain goes, pain, clicking, that's not normal. Challenge accepted. And so when I asked him if he was willing to let me just test that theory out to balance his pelvis to see if I can get his leg and femur working correctly. And so after a few visits, the clicking was gone. And his hip was more stable, his pelvis more stable. He goes, I have to tell you something. I feel like my stance is more stable. I feel like I can kick harder. And yeah, the clicking is gone. So awesome. Any questions? Sarita?
Sinuses and allergies, is that something that you've worked with or worked on?
I have worked on, it's not my specialty. There is a protocol, an acupressure protocol, to desensitize the allergen in your body. So if you have an allergen in a plastic bag, I can help your body to desensitize it. And I'll teach you a protocol that you can do at home and to check your body to make sure it desensitizes your reaction to the allergen.
I was thinking like this, the sinus issues that are just like, you don't know what triggers it, it's just constant. So that's what I'm, like I was thinking the meridian would
yes.
be connected to that somehow.
Yes, yes. Depending on what it is and depending on what kind of reaction in your body. Because some people, let's say if they have any physical hives or reaction, then I can trace it. Because I did have like a child, 10 years old, and have bumps and rashes, and the pattern was on the liver meridian. So when I used acupressure therapy on the liver meridian, it went away.
That makes sense.
So it depends on the symptoms, and then it depends on the data information that's given.
So how would somebody come to set an appointment up or have a consult? How does that work?
I do offer free consultation, of course, 15-minute free consultation. And then just like, let's say you come in and say, hey, can you work with us? And I will say the same thing, that is not my specialty, there are protocols for it. We can see maybe 1-2 appointments to see if it's helping with the symptoms, because that's always, our mind is what we can see. But the overall is, depending on what it is, whether it's diet, whether it's exercise, whether it's moving the lymphatic system, it depends on the person so that I can create a protocol for them to give it a try to see if it's working or not.
Okay, great. Thanks.
You're welcome. Yes?
Neuropathy of the feet.
Neuropathy, yes. That is usually a circulation issue. So I would give, it is not my specialty, but there are protocols for the neuropathy. And so usually it's with the heart. So when people talk about neuropathy, because it's circulation all the way down to the feet, because the feet is furthest away from the heart, so it makes the heart pump and exhaust the heart to pump blood and all the way down. And when it doesn't, that's why there's edema and there's neuropathy. So what I would do, what I suggest for that client is I would teach them how to massage the heart meridian on a daily basis. And I have success stories, but I don't have abundance of success stories for those for neuropathy. So the few that I worked with, they said this actually helps. Number one, it reduced the edema and it reduced the tingling. And acupressure therapy, if it's a physical issue as well, when I went to the leg and find out what it was kinking the meridian system there. This person, I did have a client with feet, and she goes, yeah, the tingling at the bottom was all gone, and it's only at the top from the first appointment. And then a month later, she goes, the tingling's all gone. The foot is working. But I don't have like an abundance of case studies, only a few. So, but there are protocols to help with that. Yes, sir?
So 3 things, struggling with sleep, don't know what it's caused by, stress, and is there anything that you do for psoriasis?
Yes. So psoriasis skin is a stomach meridian issue, and it comes with diet, because with stomach, it's diet and it's stress and anxiety. There are exercises, number 1, that will calm down the nervous system that I would teach my client, that they can do every day on demand when they need it. So like for my 50% of my clients are car accident clients, so they have stress and anxiety. I tell them to do this exercise before you get in the car, if you need it during, at a stop sign, and after, to make sure you maintain the stress and anxiety. But for this one, for sleep, if it's stress and anxiety, the same protocol would work. And sleep and stomach and skin issue. Skin issue, we have to change diet because that impacting the stomach. The stomach is not happy for some reason. And so what I would do, I would energize the stomach meridian on the inside, but you have to help me on the outside with the diet plan. Yes, Beth?
What about arthritis? Inflammation. Essentially, it's inflammation.
It is. It's autoimmune and inflammation, and that is a diet as well. And that is also the stomach meridian as well, because I think with diet, it's all about the gut system. So there are exercises protocol to energize the gut system, which is your second brain. And so the exercise protocols, number 1, will calm down the nervous system. 2, will energize the triple heater system that maintains, that is the ultimate control of your body. And number 3, there are points to reset the intestine, to reset so that it can process nutrient and it can flow in the correct direction. And then usually there's a polarity issue as well. And we'll reset polarity because we're a walking battery. There's positive, there's negative. And because of EMF all around in our environment, our polarity might not be in alignment. So we need to balance the polarity, reset gut system, which is the stomach area, number 2. And we have to change the diet plan and see if that works. And if that does work, we'll tag on another thing, and we have to massage the stomach meridian and energize it so it has the power to process the food that's coming in.
I think we all need to be there. Yeah.
Yes.
I agree. Okay, I'm sorry to cut this off because there's so many things that we can learn from. Thank you.